Hello, good morning. Welcome again to my channel. And today we're going to show you a video of a student in CNA performing her vital signs skills. Let's watch together.
What exactly are vital signs? Well, vital signs help assess a patient. It consists of taking the temperature, the pulse rate, the respiration rate, the oxygen saturation, and the blood pressure. What are the supplies that I need? First off, you need your stethoscope, a blood pressure cuff, a thermometer, an oximeter, and you also need a watch or a timer and some gloves and some disinfectant wipes or anything that can use that can clean your devices or the equipment that you used. Before we start, we have to perform hand hygiene and don PPE if needed. After introducing yourself and asking for the patient's name and date of birth, we are going to ask the patient's pain scale. This is in addition to taking the patient's vital signs. To get the pain reading, we are going to use the 0 to 10 numerical scale. So, from 0 to 10, what is your pain reading?
0.
If the patient is experiencing any kind of pain, it is important to document this. Now we need to use the pulse oximeter to measure the patient's oxygenation status. Place the device on the nail bed of the finger that has good circulation and then wait for the reading. Normal oxygen saturation is about 95 to 100%. Next is the body temperature. We are going to use a digital thermometer to check the patient's body temperature through the armpits. The normal body temperature is 36.5 to 37.2 degrees Celsius. Now is the pulse rate. There are three things that we have to do. First is to count the rate. Second is to measure the strength using a pulse scale. And lastly is to check the rhythm if it is regular or irregular. You can locate the pulse on the wrist where the radial artery is located, which is along the radial bone. Use your first three fingers to check the pulse. Make sure you have a watch or a timer with you as well. You have to count the pulse rate for a whole minute if it's irregular. If it's regular, you can just count for 30 seconds and then multiply it by 2. Normal pulse rate is 60 to 100 beats per minute. Next is the respiration rate. Try not to mention that you're checking this because they may alter their breathing. To check for the respiration rate, you can look at the patient's side view or you can place your hand on his chest or on his back. One rise and one fall of the chest is equal to one respiration. If it's regular, then just count for 30 seconds and multiply it by 2. And if it's irregular, then just count for the whole minute. The normal respiration rate is 12 to 20 breaths per minute. Now is the blood pressure. Make sure your patient is sitting down comfortably and their arms are at heart level and their legs should be uncrossed. Make sure your stethoscope and your blood pressure cuff is ready. Next, you have to look for the brachial artery. To find this, you need to place 2 or 3 fingers in the inner part of the patient's upper arm next to the bicep. The cuff has to be placed 2 inches above the bend of the arm. After that, we have to estimate the systolic pressure by palpating the artery and pumping until we no longer feel it. After 30 to 60 seconds, now you can take the blood pressure. Make sure to inflate the cuff 30 millimeters of mercury above the estimated number. For example, if you're taking the estimated systolic pressure number and you get 100, when you're going to take the actual blood pressure, you have to inflate the cuff up to 130. Take note that when you're taking your blood pressure, the first sound you hear is the systolic number, and the last sound is the diastolic number. The normal blood pressure of a healthy adult is 120 over 80. And remember, make sure to clean all the supplies that you used and make sure to document all your findings.
Thank you for watching, and please don't forget to hit the bell so that you will be updated every time I'm uploading a new video. Thank you very much and God bless.